Do children tolerate this heavy sedation, this medication, better than adults?
Differently. When you say better than adults, one thing about children that's interesting is that if they have a medical condition, they oftentimes still just want to be children. And, all of us understand that. So, when they get to the point where they're well enough, they want to play and do those things. But in terms of the physiology, there are physiological differences in children and adults, and that's what our special training provides us, is the ability to recognize what those physiological differences are and to make sure that they're normalized during an operation and afterwards.
Okay, because I've heard, and I'm sure many of you out there have, that Aunt Bessie went in and she had an operation, and a week later she still feels like she's groggy. Do children still feel that they have this grogginess about them well after the experience?
Well, I guess it's hard to get that report from a child, but what we typically see, the medicines are relatively short-acting. And so they're cleared within hours of the surgery. Because we're mixing different classes of sedatives together, that's why sometimes a patient will report that the next morning they woke up and they felt back to themselves. Because there's small amounts, there's residual amounts of those anesthetic agents and sedatives keep you feeling a little bit groggy. But a child sometimes, as soon as they can, they're ready to get up and run around. It may take a couple hours, they may go home and take a nap, but when they wake up and they're ready to play, you can't really hold a child down at that point.
Right. So I guess that's the best sign of all, huh, Dr. Stowe?
Sometimes your patients know better than you when they've overcome their hurdles.
We've been talking about the different types of sedations. What type of medication is used for a child as opposed to an adult? Is it the same type of medicine, just a smaller dose? Dr. Evac, let's start with you.
Yes, pretty much. If we start with the first part of the operation, the pre-medication, commonly we use a short-acting benzodiazepine called midazolam or Versed. Anybody that's in the healthcare field has heard that. It's probably been around 20 years now, I suppose. But that is a common medicine used as a pre-medication for the children because it's so short-acting and, as Brent said, can be metabolized or cleared by the body so that there's not a lot of residual hangover or sedative effect afterwards. Or other medications we use, narcotic pain medications are pretty much the same for adults and children. Our anesthetic gases are pretty much the same for adults and children. Some other medicines we use are pretty much the same, but at size appropriate doses.
As far as food and drink, when we go in for procedures, we're not supposed to eat or drink beforehand or fast. It's easier said than done, I would think, for children. So what are the guidelines for kids?
Specifically, we would like to have the children not eat, if they're older than 6 months, not eat for 6 hours before the procedure. But we do not want to have them come to us in a dehydrated state. So we encourage them to drink clear liquids, and they can drink those clear liquids up until 2 hours before a procedure. Certainly for a first case in the morning, the child will have slept through the night and just come to the hospital. But for a procedure that's done maybe at 11 o'clock, it would be fine for that child to drink Gatorade, apple juice, water, not milk, but something, sugar water, essentially. And it makes the child more comfortable, and it helps us as well.
Yeah, no child likes to be fasting, but there are reasons behind the fasting guidelines, and that's to make sure the stomach has cleared most of its contents by the time it's time to put the child under anesthesia. And the reason we do that is a stomach that has contents in it, the patient is more prone to aspirating those contents into their lungs, because when you fall asleep under general anesthesia, you become unconscious and lose all of your reflexes, including what we call the airway reflexes. That would be if you drank some liquid and it tried to go down the wrong hole into your lungs, you have, when you're alert and awake, you cough and prevent those liquids from getting into your lungs. When someone goes to sleep under general anesthesia, those reflexes are lost, and there's the danger that stomach contents could get into the lungs, which can make someone quite sick.
So it's an unnecessary complication that's avoidable if people don't eat. And so it's just one other safety measure before people are sedated.
Okay. As far as a child compared to an adult, what are the risks? Are there more risks for children as opposed to an adult going under anesthesia?
It depends a lot on their medical condition. And I think you bring up the word risks. There are risks with everything we do. But some things are maybe less risky, and some things are more risky, and some things are dangerous. We don't consider, if we do things properly, evaluate people, we try to minimize the risk so that things aren't dangerous. Is that...
It does, but I guess what I want to ask you is it dangerous to be put to sleep?
There is an inherent danger in anesthesia, which is why we have gone through the training we've gone through, because you really do alter a person's physiology. They may not be breathing on their own anymore. Their blood pressure and heart rate may change during the procedure. And all of that needs to be monitored appropriately and addressed if it happens. And so...
and that's your job.
That's what we do. And so we don't have a lot of anxiety about that because we've done this over and over again. And so it is a routine. But there is that danger. It has to be done properly.
Okay. And I'm sure I'm asking questions that you answer every day, right?
Exactly. And I think overall, in a healthy child having anesthesia, it is a very, very safe procedure. But there are risks in children that are different than risks in adults. And some of those risks can include situations that we call bronchospasm or laryngospasm that children are a little bit more prone to have than an adult having anesthesia. And that's why I think it's so important that our core group of pediatric anesthesiologists are solely devoted to taking care of children. We are used to dealing with those complications when they arise and can quickly address those things competently, expertly, and help resolve the situation in a safe manner.
Do you also get that message out to the parents? What you just said? Because that would make me feel, oh my gosh, this is the man or woman to do my anesthesiology for my child here. To know that you have been trained to look out for situations like this that may be different than an adult.
I think we get that message across to parents preoperatively when we visit them. Does the public as a whole really understand that? I'm not so sure. Personally. I think with the Levine Children's Hospital, that will be the center of excellence, in the region, and that every person in there, from the child life specialist to the nurses, to this neonatal and pediatric intensivist, to the surgical group, to the pediatricians, to the anesthesiologists, are all trained specially to deal with children. I think that message will become readily apparent.
Specialized. That's the key word, I think, right? Let's go to Debbie in Belmont. Hi, welcome to HealthWise.
Good evening, gentlemen.
What's your question for this team?
My question is, when a child has an IV, what precautions are taken that the child cannot remove the IV?
What precautions are taken to make sure that child does not remove the IV? Is that it, Debbie? Great
Right.
question. Let's see what they have to say. Who wants to take it? All right, Dr. Holloway, you're
I'll
up.
take it. Children oftentimes do not like an IV, even after they're awakening. It's not painful. We tape them up as best we can, and then we wrap them with a wrap so that it makes it more difficult for the child to remove the IV. Occasionally, they're successful, but we certainly try our hardest because it's much more difficult to place the IV in the child once they're awake.
Okay. Thank you so much. Have a nice night.
Debbie, thank you so much for contributing to this show. Half the hour is gone. We're having a very candid and wonderful discussion on surgery and children being put to sleep for a procedure. Stick around. HealthWise continues right here on WTVI.